if you've been diagnosed with a cataract and you need surgery, there are two main decisions you need to make. One is the method by which you do the surgery, and second is the lens that you implant. So first, we talk about the method. There are two methods. One is the phacoemulsification and the second is called FLACS, FLACS, Femto Laser Assisted Cataract Surgery. Now, there are four main differences. One is the incision, second is the capsular axis, third is breaking the cataract, and fourth is cylindrical power. The first difference, the incisions in the phacoemulsification are made by blades. In Femto, they are made by the laser. It's a bladeless surgery. Second is the opening in the anterior capsule, which is the most important step in the cataract surgery, is done with a forceps. Here it is done with the laser and it's a perfect circle. This helps in perfectly centrally aligning the lens on the visual axis. The third is here the cataract is broken with the help of a chopper or a Sinskey hook into smaller pieces so that they can be emulsified. Here in Femto, we get the pieces pre-cut into 6 or 8 pieces based on the hardness of the cataract, and therefore there is less difficulty and less struggle and less chances of complication at the time of breaking the nucleus or the cataract into smaller pieces. Also, as it is pre-cut, the energy used is almost 40 to 50% less, thereby generating less heat and thereby causing lesser inflammation in the cornea after the surgery. The fourth point is the cylindrical number. If you have a small cylindrical number, it would be left behind with a regular phacoemulsification surgery. However, the femto laser, the machine has a method by which it can eliminate that cylinder and bring it to as close to zero as possible. I feel this is one of the most important points because that little cylinder being removed and not having that number gives much more clarity in the vision postoperatively. And if you have a larger cylindrical number, then we have to use a toric lens. The toric lens has a particular axis on which you have to place it. So in the manual technique, we make marks with the ink pen, and therefore the cylindrical axis can be off by 5 degrees here or there. However, in the femto laser, the placement of the cylindrical lens is just perfect. On the rexis, the laser gives us two markings or nubs, which is called the intelliaxis, thereby taking into account the exact location or the positioning of the toric lens based even after cyclorotation, and therefore removing any parallax error and thereby giving the perfect location or the perfect positioning of the cylindrical or toric lens. So in short, the femto laser advantages are: first, safety, 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 much more precision, better sharpness of vision after surgery as the smaller number of cylinder is removed. And fourth, if it's a hard cataract, it breaks the cataract into smaller pieces, thereby giving less heat generation. And fifth is positioning of the cylindrical lens or eliminating small cylindrical numbers. So now there are three types of lenses that can be implanted during a cataract surgery. The first is a monofocal lens, second is EDOF, and the third is a trifocal lens. The monofocal lens gives you good distance vision without glasses, but you will require a 1 to 1.5 number for computer and a 2.5 to 3 number for reading your mobile or any book. The second lens is the EDOF lens, extended depth of focus lens. So not only can you see distance clearly, but you can also see intermediate clearly. People who spend a lot of time on the computer, this is a great lens because you will not need to wear glasses for computer use. Second, it also helps with intermediate distances like shaving. Second, while cooking. Third, when you want to see something on a shelf or a price tag. However, for near, the patient will require a 1 to 1.5 near number, but it's much less than the monofocal lens. The third lens is a trifocal lens. Trifocal means three foci. One is distance, second is intermediate, and third is near. The patient will not require glasses for all the three distances. Patients who are very keen on not wearing specs, this is the ideal lens for them. Now, all these lenses do not promise freedom from glasses, even the trifocal. It just tells that you will get 85 to 90% less dependency on glasses. You will always have a very small number which you can decide to wear or not wear. The EDOF lenses and the trifocal lenses come with either spherical aberrations or with rings. There are also EDOF lenses which come without spherical aberrations and no rings. If the patient is going to be driving at night or does not want the halos and glare, then one can go for the ring-free or spherical aberration-free lenses. So based on what your requirement is, what is your budget, what is your day-to-day life like, do you drive, do you use the computer, do you want to be free of glasses, this helps you and us decide which lens is best suited for you.